So good afternoon, colleagues, ladies and gentlemen. I'd like to welcome you to this session on our health and our society. My name is John Ryan. I'm the Director of Public Health in the European Commission. And it's a great honor for me to be here today to have this discussion with you on topics around health and society. Émile Zola, the famous French writer, once said that the future of humanity lay in the progress of reason through science. And I guess that's why there are so many people here today. It's a question of science, it's also a question of progress, and it's a question of humanity. And I think the word health also includes those three concepts. So one important point which I would like to make from the Commission's point of view is the idea that science, and especially research and innovation, also is built on effective collaboration. Health research and innovation in Europe is very much a team effort across and within EU countries. And I'm particularly delighted that here today in Brussels we have so many crucial partners and stakeholders from the health community who are part of this discussion. One of the goals of today's event is indeed to deepen the collaboration and help to establish a true pan-European research and innovation community. And these meetings we've been having here in Brussels are a good start to this process. So, ladies and gentlemen, I'd like to say that we're not starting by any means from scratch, of course, and we have made great progress in certain areas, and there's a lot which remains to be done. If you look, for example, at the recent creation of the European reference networks, we now have 24 European reference networks linking European hospitals and clinics together across Europe to help patients with rare diseases and to bring together the expertise in these hospitals in a collaborative way to actually help citizens. There are 900 of these units gathered together in the European reference networks and over 300 hospitals involved. So I think the scale of this is also impressive. And this is a clear example of how the EU can add value to our health systems by connecting stakeholders, by identifying priorities, and by concentrating the expertise. These clinics and these networks are delivering concrete, practical benefits to patients in the form of answers, diagnosis, and treatment plans. And as you know, for rare diseases, this is particularly problematic for some member states. So as I said before, I think we have made progress in certain areas, and we certainly need to do more. And the future EU research programme, Horizon Europe, is a very effective vehicle for bringing these dreams into reality. And the first step, I think, is to reach out to the academic community, to researchers, and also to our member states, because when you're talking about health, you're talking about national health systems. And I think these three categories, together with patients groups, are really the components of a successful solution. The involvement of health professionals, patients, and civil society representatives, public health authorities, is for the Commission essential in the recipe to make Horizon Europe work. The proposed budget for Horizon Europe, which is still being discussed in the European Council and the European Parliament, is proposed by the Commission to be about 100 billion euros for the 7 years from 2021 to 2027. And of that total of 100 billion euros, 7.7 billion have been reserved for health. Although I must emphasize that there are health components of other parts of the programme as well. So we're talking about a health cluster with a budget of 7.7 billion over 7 years, but there are health components elsewhere in the budget as well. So that's a minimum rather than a maximum. The Commission has developed what we call an orientation document or a strategy document to explain how we see the first few years of the programme rolling out. And this, of course, also includes a strategic plan in the health area. And this has now been put on the internet for consultation, for public consultation. The last count I saw, there were over 6,000 responses, and that's an opportunity for you in the room here, if you do want to come back and give us some ideas based on what you've heard over the Research and Innovation Days. The consultation process is still open. And we're also discussing, of course, with the Member States, and we'll also be discussing with European level organisations to try and figure out what the value added would be of certain activities. So today's conference is, for us, an important part of this process of getting feedback. And I do hope that after our three speakers have spoken, have given you their points of view, we will have some time to also have a dialogue with you. And this will help us to guide the first 4 years of implementation of this new research program. In other words, from 2021 to 2024. This co-design process, which we're trying to roll out at the moment, is designed to improve daily lives of citizens, to move major societal challenges like climate change, or indeed things like cancer, into innovative opportunities, and to identify solutions for a sustainable future within the context of the Sustainable Development Goals. The health cluster of Horizon Europe, which is the health part of Horizon Europe, will provide major research opportunities and ensure a greater synergy with policies and programs. And I'd just like to emphasize that point, that there will be a close link between the policy needs of the Member States, the gaps that we identify with the patient organisations, with the health professionals, and the research investments. This is really a key to reaching a success. And the Health in All Policies approach is one which we're also going to follow with the research programme by engaging with other EU funding programmes like the Social Fund. So research programme, health programme, social fund, we're going to try and mobilise these funds to reach a result on a common topic. So, I mentioned the social fund, I mentioned the health programme, but, you also have the EU structural funds and the EU investment funds. And really our ambition is to be much more ambitious, much more horizontal in our approach of financing these research initiatives and bringing them to implementation on the ground. So we're facing important challenges, as you know, in terms of the Sustainable Development Goals, in terms of cancer, the growing incidence of cancer, and the Commission has proposed, in addition to the research programme, we have proposed a Europe Beating Cancer programme or action plan, which is being developed at the moment. But also in the area of vaccine hesitancy. We had a major conference with WHO here very recently to look at the global challenge of vaccine hesitancy and the problem we have in actually protecting people from known diseases where there is an available vaccine. It's a real scandal, and I think we're trying to mobilize health professionals to try and get something done about this. Working closely with WHO, the AMR, the antimicrobial resistance challenge, is also an enormous challenge for our societies. This is really like a train coming down the line. We can see it coming, and it will pose a huge problem for our health systems, for our health professionals, for even simple things like getting your tooth removed in a dentist in a couple of years' time could be a challenge. So antimicrobial resistance is really something which is a major focus here. And of course, the greater mobility of people and diseases is also a challenge, in the sense that with a globalized world, with increase in travel, with zoonotic diseases, with climate change linked evolving diseases, you also have challenges maybe we didn't have 10 years ago. So our overall aim is to achieve a seamless innovation loop. In other words, from the concept to real-life application of new technologies, new knowledge and treatments. And at the same time, we hope that this application will provide questions for future research, so it will continue in a virtuous circle. The next speakers we have in this afternoon session will address 3 questions. What are the priorities for the citizen and the patient? What are the trends and how will they affect our health, our lives and our society? And what innovations and solutions are emerging to help us address these problems? Before giving them the floor, I would like to conclude by the fact that we're operating in the framework of the UN Sustainable Development Goals. The progress is not quick enough in order to reach these goals at the European Union level. And that's why we think that reducing health inequalities in particular between the member states and between population groups in the member states is really a key component as well, also for the research programme. And we'd like to keep these goals in the forefront of our discussions later on. So our first speaker this afternoon is Dr. Osman Khan, who is the Executive Director of the European Patients Forum, and he will address the role played by patients when setting research agendas. Thank you.
Many thanks, John, and good afternoon, everyone. And for those of you coming from outside of Brussels, welcome to Brussels. You might have noticed it's not quite like Venice, although we do have one channel. But it's a lovely place to be, and I think it's an important point, I have to say, for those of us that work in Brussels, in the health community. You as the research community are an incredibly important part of what we do. As you'll be aware, the European Commission does not have central competence around health, and we know it does very important work. DG Sante, other agencies like the CDC, we know the important work they do. But a lot of what happens in terms of support for health comes from programs like what will be Horizon Europe, and prior to that, Horizon 2020 and FP6 and FP5 before it. What I want to do over the next 15 minutes is just to be able to give you a little bit of an insight into the patient community in Brussels and in Europe, who you're working with, who you're dealing with, and then talk about two aspects. One is the patient perspective and the importance of the patient perspective. And as you're putting proposals together going forward and you're putting consortia together going forward, how you're able to think about the notion of the patient perspective. The second is the patient voice. And that is the sort of mechanics of being able to engage with patients, patient communities, patient advocates, to be able to inform all aspects, and I will stress on all aspects of your research programs, and to look a little bit at some of the organizational challenges involved as well as those organizational opportunities. And I hope in total it will give you a sense of what's possible and what's needed and what's different, I think, between Horizon 2020 and previous framework programs and Horizon Europe. And I think the fact that the European Patients Forum has been asked to speak at an important event like this is no small signifier of a change of approach or an evolution of an approach in terms of the recognition of the importance of the patient and the citizen in health policy and practice. So I won't do too much of an advertisement, but just to say the European Patients Forum, we've been around just short of 14 years. We are a network of networks based here in Brussels. So our member organizations are basically 74 European patients associations associated with particular conditions, particular diseases. So it may be Alzheimer's Europe or the European Multiple Sclerosis Platform. These are condition-specific groups, but patients groups. And it's important to make that differentiation between condition groups, European Cancer Leagues, and a particular organization, which is a patients organization led by and focused on the needs of patients. So we operate in Brussels, and then as obviously you'll recognize within each of the member states, our network continues to cascade down, both in terms of national coalitions of patients and patient advocates, but also in terms of individual patient organizations and patient advocates. So that's a little bit of what we're dealing with in terms of the infrastructure. Now I want to just focus on two connected issues. One is about the patient perspective, and the second is around, connected to that, the patient voice. Now the patient perspective is something which we as the European Patients Forum do three main activities. One is to be able to introduce and add the patient perspective to European health policy and practice. So my very presence here today is an example of how we will introduce the patient perspective. The second element is the work we do on education and training to be able to increase capacity and capability of patient advocates to be able to advocate for themselves and collectively in a whole range of areas, from medicines development to care pathway reform to services and care within a range of hospital settings. And then the third area is patient impact, which is where the European Patients Forum will work in partnership with colleagues such as yourselves. There may be colleagues in the audience this afternoon who work with the European Patients Forum, where we're working on Horizon 2020 projects or the Innovative Medicines Initiative, IMI projects, or other such projects, where we have been brought in to be able to, as I say, do these two things of both patient perspective and patient voice. So that patient perspective is something which we're trying to introduce into the narrative, so it's understood and considered and embedded within health policy and practice, and now in terms of health research. And that really is a matter we can do. The easiest way is to do the similarities when you talk about a clinical perspective. People are not concerned about saying, yes, well, we need to look at a particular aspect from a clinical perspective, or we may more operationally talk about it in terms of management perspective. Well, equally, there's a prism that one can look at, which is about the patient perspective, and to be able to look at an issue from that particular vantage point, to be able to ask the questions which will really take you into that orientation. And it's very important to be able to do that right from the outset. When you're thinking about your initial, you see the calls, both the calls for proposals, you will more increasingly see patient perspective woven into that. And you will need to be able to respond to that in terms of calls, but also in terms of how you focus those proposals, how you also develop your consortia. You will need to think about this idea of the patient perspective. And I will just dwell, as I always do when I take a platform, to say that I have an advantage over lawyers, I have an advantage over accountants, I have an advantage over a whole range of professionals, that I am able to say that the one thing that we all share in common in this room is that we're patients. And the fact that we are all patients, we have been, we will be, we were. And that is important, and I would ask you to connect as a group and as individuals to be able to visit that space. Whether it's, as John was talking about, whether it's going to the dentist or whether it's something more life-informing, you yourselves will always be able to adopt a patient perspective and to be able to adopt those questions. Go through that journey, think about that process is a useful starting point to know how you can do that. You can also connect with organizations, with other academic institutions which are working in this area to understand it, but you can start yourself. So in terms of being able to say, how have you looked at a particular problem definition? How have you looked at a methodology? How have you looked at a theory of change from a patient perspective? Will be important to be able to do, but also to be able to demonstrate that you've done that, because increasingly this is going to be a way that your proposals are going to be assessed. What I would then connect that to as a very distinct but related element is patient voice. And patient voice is where individuals and where collectives have come together to be able to say, we are willing and prepared to advocate for our condition, to be able to say that you can all do this yourself. I mean, I can do this myself. I can say I have had a range of conditions over my lifetime, some more serious than others. What I don't do is advocate for them. What I don't do is put my head above the parapet and say, I'm prepared to access that experience, the good parts, the bad parts, the difficult parts, maybe the empowering parts, to be able to help inform health policy and practice improvement. What health advocates do and health advocacy organizations do is give you access to that. They give you access, and they also have that experience of being able to engage in health policy and practice. They're well versed in it. They know how to do it. They're used to being approached. They're used to being involved. And if I give one example of, we have one of our training programs is a youth training program where we bring young patients who have been diagnosed with quite often really quite significant long-term conditions between the ages of 18 and 30. And we bring them together as a group every year, and we do some training and development work, and we bring them to a face-to-face session in Vienna over the summer, where they are taught all the issues about being able to understand themselves, about personal development, about self-empowerment, but also understanding how health systems and processes work, understanding how the regulatory process works, being able to then contribute to health policy and practice, and that includes the research process. Those individuals, those organizations are out there, and they're available for you to be able to access. What I would say, however, is that we are not at the level of being able to provide the clinical perspective or the managerial perspective. The patient perspective is running on a shoestring. We are not funded through our occupations. We are not funded through the organizations we are in. We are working on far lower resource bases and with far less time availability. So where you do engage with us, understand what you're engaging with and treat us in that way. Don't say that patients and patient organizations are a free resource. They're not a free resource. They're giving of their time voluntarily, and they're giving of their emotion and their commitment. And I would ask that you recognize that when you engage. I'd also ask you to recognize that whether it's EPF, we are one of the better resourced NGOs at a European level, and we have a secretariat of 20, of which 2 or 3 will work on policy areas and 2 or 3 will work on our projects. So the ability of them to have free time to be able to talk to you is pretty limited. When you go down to the level of a condition-specific patients organization at a national level, you could be talking about a very small setup with 1 or 2 individuals doing this off their own back and their own volition. And just be cognizant of that and be respectful of that, of when you engage. But if you do that, I think it is difficult to, I shouldn't say this, because having worked on a range of projects with colleagues such as yourselves from academic institutions, from policy institutions and the such like, I know the commitment that you bring to the health projects that you work on, and your commitment to being able to understand things from a patient perspective. And the opportunities, you'll know that if you've already done it. You'll know the richness of being able to suddenly see a challenge from a different perspective, suddenly being able to say a different way of being able to anything from designing a Delphi to being able to do an evidence review to engaging through focus groups or other stakeholder engagement programs, to designing a theory of change, putting together a logic model. When you do that and you sit alongside patient researchers and patients who are able to support that research process, then you really do see the richness that you're able to bring out. So the benefits are significant, and I have to say, I just want to say that certainly the conversations that I've had, I've been in post now 4 months, and I've had 3 discussions with Anne Boucher as director at DG Santé, a recognition of how the patient perspective and the patient voice is being viewed here in Brussels, and viewed by the European Commission and viewed by the European Parliament and other organizations. So I think what I would say is that think about it, look for the organizations, reach out to be able to see how you can connect, and then to be able to see what benefit you can get from it. And I'll just leave with just one example, which I only heard about the day before yesterday, but it really resonated with me in terms of what adopting a patient perspective and engaging with a patient voice can allow you to realize. And this was in relation to looking at medtech, and there's a lot of really exciting developments being made around technology and health. And this related to something as important, but as simple in many ways in healthcare as colostomy bags, where we all know it's one of those things, it's something a little bit embarrassing, you don't want to talk about it, you don't want to think about it. And I was minded that a colleague of mine from when I was working in local government in Sheffield in the 1980s, and he got colorectal cancer and had to have a colostomy bag, and it really struck with me. He died in his mid-50s, very sadly. And Keith always had that sense of humor, and he always said, "Oh, I've got my colostomy bag. If it makes a noise, it's not me, it's the bag. Blame the bag, don't blame me." And there was always a slight joke about it. But what he was actually saying was he never knew when that bag was full or not. He'd need to go to a toilet, he'd need to take time out from when he was working. He was a senior director working in local government, and he needed to take time out to be able to do it. Fast forward to 2 days ago, when I was told about an initiative driven by a patient who said, "Can't we just put a monitor in colostomy bags that will send me a push notification on my phone that will tell me when the bag is full and give me suitable notice, then I can know when I need to be able to take a comfort break." Fascinating, isn't it, that that's taken over 30 years to move from a clinical perspective of what the problem was and what the solution was to a patient perspective and patient voice of what the problem was and what the solution was. So just that last one that I just want to leave you with, to be able to understand what patient perspective can add and what patient voice can add, and to also just say to you, the European Patients Forum, also at a condition level, our member organizations are available. We have limited time, limited resource, but please reach out if there's anything that you feel that you want to know about in order to be able to bring those two aspects to bear. Thank you very much.
So thank you very much, Osman, for that perspective on the contribution that patient groups can make to the setting of research priorities. Our next speaker is Dr. Soumya Swaminathan, who is the Chief Scientist of the World Health Organization. She is a pediatrician from India with a globally recognized researcher on tuberculosis and HIV. And she's worked through her career, I think, to translate research into clinical practice. So I'm looking forward to your perspective also from the point of view of the World Health Organization. Please.
Thank you very much, John. Good afternoon, ladies and gentlemen. What I'd like to do is just give you a little bit of a flavor of how we're thinking about research and innovation at the World Health Organization. I'm the first chief scientist, and many of you may know, or some may not know, that as part of our transformation, the Director General, Dr. Tedros, created a division of science. Even though WHO has been a normative agency, a science-based agency for the last 70 years, we now have a very explicit focus. And the reason is really for us to be able to stay ahead of the curve, to know what's coming in the future, how it's going to impact health, whether it's new technologies or it's new threats to global health, to try and be prepared and to help countries also prepare themselves. And I think the Horizon program is a very exciting and interesting one because they've identified some of the really big threats that we are going to face jointly as humanity. And I think we have to find solutions in solidarity. I think gone are the days when we could think about our own countries or our own regions and be satisfied with the solutions that work for us. It's no longer the case. I think we live in a world where there are global threats and we need to find global solutions. I also appreciated the comments made by Usman on the role of patience, and we do believe that that science can work for people only with the involvement of people. And I think one of the big challenges of our time is science communication, is getting people. The Wellcome Trust recently did this review of public across the world in, I think, 140 countries, and what they believe in science and health. Luckily, the good news was that the overwhelming majority of people said they did have faith in scientists and in doctors and health professionals in general. So that was the good news. But the not so good news was that it's actually the more literate countries, the more highly developed countries, in particular in Europe, that had a lot of misconceptions, doubts, including things like vaccine hesitancy. It was almost a third of people in France who questioned the role of vaccines or questioned the safety of vaccines. And so this is, as John mentioned, we had a global vaccine summit here 2 weeks ago, and this was one of the issues that were really prominently discussed because we see growing outbreaks of measles, diphtheria, diseases for which there are known vaccines. I mean, forget about diseases like Ebola, where we're still, finding the therapeutics and the vaccines. So to come back to what we need now to inform research and research priorities, we're setting up a foresight function, as I said, is to look into the future and see where we need to focus. What are those new technologies in terms of digital tools, artificial intelligence, machine learning, wearable devices, and so on, which can have big impacts on people managing their own health, but also on health workers and doctors, making it easier for them to provide health care. And I think we always have to think about not creating a further divide, what sometimes is called a digital divide between people who have access to all of these latest technologies and people who don't. Because if we do not think about those aspects, then I think health inequities will worsen within countries and also between countries. So WHO's goal is really to try to harness these technologies to provide services to populations which did not have access. Could we use telemedicine, for example? Could we use mobile phones to actually deliver health messages, as well as at times even healthcare delivery? And this has been tested in many countries and found at small scale to be reasonably successful. But the challenge before us now is to scale up. And I think this is where the global outlook of the European, the huge amount of resources, the strengths and the capacities which exist in the European region could really help to inform and strengthen the capacities of healthcare systems in those countries which do not have this kind of, especially research and innovation capacity. We also are looking at how can you influence research funders to direct research dollars into areas which are needed. So really prioritization and targeting of research. So 3 years ago, the WHO launched the Global Health R&D Observatory. This was a request from member states to track where the research dollars are going, who's funding, in which countries, where, and on what type of diseases, and what are the outcomes. And if you look at that, it gives you a wealth of information about where research is occurring in which areas. And an analysis recently done of more than 80,000 products which are in the pipeline, this includes devices, drugs, vaccines, diagnostics, etc., showed that only 0.5% of these products in the pipeline are targeting one of the neglected diseases. And again, less than 0.4% were targeting a priority pathogen. And these pathogens include the ones that John was mentioning, the AMR issue, diseases like Lassa, Ebola, Nipah, MERS, etc., which can really become pandemics and we don't have the appropriate tools for these. It also showed an analysis of the 10 major global research funders showed that almost 3/4 of their grants were for non-communicable diseases. But if you looked at the distribution, very little of this funding actually went into the low-income countries. So there was less than 1% of funding that went into low-income countries, and most of this was focused on communicable diseases and maternal and child health. So right away you start seeing the divergence between the burden of disease and where the funding is going, because the burden of disease certainly is going towards non-communicable diseases, even in the poorest countries and definitely in the middle-income and lower middle-income countries. So I think just looking at data, being able to share data and look at it really informs us of where the gaps are. Another way of identifying the gaps is when we do normative work, when we do standard setting, and many organizations in Europe do that as well as WHO. We do guidelines all the time. And when you do the guidelines, you evaluate the evidence base by doing systematic reviews. And this throws up many areas where there are gaps. So again, if every organization really had a systematic way of identifying the gaps in knowledge and putting those forward, this would again provide research funders with a list of priorities. The other important issue that's come up recently is as part of the work that we did on the SDG Global Action Plan. As you know, the heads of Germany, Norway, and Ghana requested the Director General of WHO to work with the other multilaterals and big global health partners to develop a roadmap to achieve the SDG 3. So 12 organizations came together last year, and in fact, yesterday at UNGA in New York, this report was launched. It identified 7 accelerators, and as was mentioned earlier, the world is not on track to achieve the SDGs, and certainly SDG 3. No country in the world, in fact, will achieve SDG 3 by 2030 if we continue at this pace. So one of the accelerators identified was R&D, innovation, and access. And the focus there really is on the global side to work, for WHO to work with the product development partnerships, with the research funders, also with industry, to try and target the funding to those innovations which are most needed. But also identified as a big gap was at the national level, again, particularly in the low middle-income countries, for ownership, local ownership, leadership, and really to shift the center of balance from decisions not being made always by the developed world, but allowing decision-making on local health priorities to be set within the context of those countries and to facilitate more research and innovation in those areas. The other point that's really important to note is that it's no point just having the innovations available and sitting on the shelf. You need access. People need access to innovations. And in the past, the model that's worked is the private sector doing most of the work on innovations, addressing those diseases where there's a clear market. Now, that model doesn't work for diseases which affect mainly the poor or where there's no clear market available. You can take even the outbreak diseases like Ebola. The market is not a viable long-term market for any private company to invest. And that is why there have been more and more global initiatives like CEPI, the Coalition for Epidemic Preparedness and Innovation, where public funding is going into the R&D, early stage R&D for tools, diagnostics, vaccines, and therapeutics to address these unmet health needs. And therefore, it's important that the access provisions are built into these funding contracts that are done at early stages. And secondly, we need to think about the the whole process, the value chain from R&D, early stage investments, to all the phases of clinical trials, to finally the product becoming available. And we've seen time and again in the past that you have a development of a much needed product, but it takes 10 or 15 years or even longer for it to actually find its way into country health systems, unless you have, again, a clear mechanism forward for scale-up of innovations. So agencies like Gavi have been able to have a big impact in the area of vaccines, but it also requires a period of preparation within the country for scaling up something new, and that requires implementation research and operational research. It requires very often interdisciplinary, and because the behavioral sciences and social sciences are often forgotten till the very last minute. So we do the biomedical research, we don't do the socio-behavioral or social science research, and then you find that something is not acceptable to that community because of certain reasons. So I think the multidisciplinary research and intersectoral is becoming more and more important, especially when we think about well-being, not just treating or preventing illness, but how do you actually stay healthy and well. And as populations are aging, it's really important to focus also on research that's going to be needed to maintain well-being. So I think to conclude, I would say that the days of past when patients were the recipients of things that came to them at the end of the pipeline, the same is true for governments and health systems. It needs to be a participatory approach right from the beginning. I think we need all stakeholders around the table so that everyone's perspectives can be taken into account. And ultimately, as I said, for the fruits of R&D to actually have an impact on public health, it's important to really think through what's going to be needed to take all of that into policy and then into practice. Thank you very much for this opportunity.
So thank you very much for the international perspective on the basis of your huge experience and also the WHO priorities and point of view. And our last speaker this afternoon is Minister of Social Affairs in the state of Baden-Württemberg in Germany. He has had a very practical experience, I would say, of over 25 years working in a social psychiatric service in the south of Germany. And he's taken responsibility for several projects in this field as well. He's studied social work in the university setting, and he's now responsible for a wide range of government affairs relating to social and integration policy. And I'd like to invite Manfred Luca to come to the floor. Thank you.
Thank you very much for your nice invitation, Mr. Ryan. Dear ladies and gentlemen, yes, thank you very much for the invitation. I feel very honored at the opportunity to speak before this well-informed and international audience today and the two speakers before, the global perspective. May I kindly request your patience and understanding with my South German tainted subalpine English. I will try my very best. Some of you know Mr. Oettinger, the commissioner. My English is as well as so, because you know a federal state minister in south of Germany is not trained to talk in English to the people of our tiny little country. So I hope you will understand me. Maybe you have to ask afterwards. Yes, ladies and gentlemen, every individual should receive the right treatment at the right place and at the right time. This is the objective of the Baden-Württemberg state government, and as the Minister of Health of our federal state, it's mine too. Presently, I see three major lines of development in the European health policy. First of all, demographic change, which goes hand in hand with aging societies, but also means an increase in the number of chronic diseases and a growing number of so-called lifestyle diseases, obesity, diabetes, for example. Secondly, technical progress with regard to digitalization and personalized medicine, these being the largest fields of actions that will utterly and completely change the world of medicine as we know it. Thirdly, a lack of skilled workers, especially in the nursing care and medical sectors. To start with, we need a healthcare system that does not shy away from new developments. Quite the contrary, we need a healthcare system that utilizes these developments in a targeted way to bring about improvements. Yet, without neglecting the risk and problems involved. Secondly, we need a healthcare system that is uncomplicated, transparent, and a system that people understand. Thirdly, we need a healthcare system that can transcend rigid boundaries. By that, I am not simply referring to the sectoral boundaries as we perceive them, for example, between general practitioners and specialists, hospitals and nursing care, or preventative care and rehabilitation, but also, quite unequivocally, national borders. Here, in Europe, we need to cooperate more closely, network more closely, exchange more information, and succeeded at learning from one another. And we also may not lose sight of the pan-European perspective. When it comes to junior physicians, for example, it goes without saying that we are delighted that young physicians from across Europe and around the world would like to work in our Baden-Württemberg. However, taking these doctors away from their home countries where they are needed wouldn't be right. We have to undertake joint efforts to find good healthcare solutions for the respective countries. Here, one aspect is crystal clear. With all of our actions, and we heard it before, it is the patients who are at the center of all our work. Everything must revolve around their well-being. Yes, ladies and gentlemen, digital change is just as profound as, for instance, the invention of X-rays or the discovery of antibiotics. It would seem that digitalization and artificial intelligence offer endless opportunities for the medical sector, and there can be no doubt. We need to seize these opportunities. Improved diagnosis, improved therapies, improved care. all for the better informed patients. That's my goal, and I'm working very hard to achieve in our federal state. We cannot allow discrimination or exclusion. Everyone must be able to benefit from digital opportunities. And this also holds true for those who are not digital natives. I am also no digital native. We cannot accept gaps and errors in data privacy. And we do not desire, nor do we strive for, nor do we even believe it is possible to have a future in which machines will replace doctors and specialist staff. Because no machine can replace human empathy and care. Digital change calls for courage and at the same time humility. In the following, I would like to say a few words about my experience as the health minister of this German federal state in the southwest. Here in Baden-Württemberg, my federal state, we have been shaping digital change for quite some time now. Please forgive me if I say this with some pride. When it comes to e-health, Baden-Württemberg catches the attention of representatives of health policy and the healthcare sector in Germany. We have a federal state digitalization strategy, digital at BW point. And we will be investing about 1 billion euros in digitalization during this legislative period. Health and healthcare play an important role here. With, we heard before, the Doc Direct project, for instance, we operate the first remote treatment for patients with the statutory health insurance in Germany. Together with the Association of Statutory Health Insurance Physicians, for me it's now not easy to say. For example, we want to succeed at avoiding unnecessary context between patients and hospital outpatient departments and relief medical practices in undersupplied regions. Following it launched in a region like Tuttlingen, some of you know it for the medicine products, very important, and Stuttgart, the main capital, also we had countryside and we had the town metropole side. Doc Direct has been up and run for all patients throughout Baden-Württemberg since October 2018. We have also reached the next stage using funds of the digitalization strategy. The federal state is founding the protected e-prescription service of pharmacies. Model project of the Pharmacists Association and the Chamber of Pharmacists with 1 billion euros. The first e-prescription is to be issued to the statutory insured patients now in the next month. Here we are in Baden-Württemberg, a pioneer in Germany, and we know we are in Germany not pioneers by digitalization in healthcare. We are the biggest country in Europe, but there we play not Champions League, but we have to change it. Because we unite the three important cornerstones of digitalization in our federal state. Research, economy, and care. Last year we founded the Baden-Württemberg Health Forum. Here we get all the players together, we create new alliances, star alliance, you know, in the sky, and provide a setting that allows innovations. The needs of people, everyday life, professional practice, science, and the latest technologies and processes. That's what we bring together, and that is what we want to connect more closely. This way we can broaden our position as a business location and open up new areas of growth. Here, digitalization and artificial intelligence are an important topic. We also promote personalized medicine under the heading of this Health Location Forum. Personalized medicine is regarded as a paradigm shift in therapy. Research, care, and digitalization meet here. The goal is to have a precise understanding and treatment of the symptoms. We are talking about precision medicine. Huge data volumes are used to promote this, and we have to be in a position to master it. Thanks to interoperable databases, we can search for the same or similar patterns. We cannot afford to make any mistakes, and transparency and security are indispensable. The European Commission would like to create reliable standards for collecting and exchanging sensitive data, and that is a good thing. In Baden-Württemberg, innovation and participation come together. This means, firstly, we bring all actors together. Politics, hospitals, general practitioners, statutory health insurance, patients and their associations, as well as university hospitals. Secondly, I think it's the main point. We understand personalized medicine not only from the aspect of the freedom of research, but also from the aspect of responsibility in healthcare. For us, it's all about bringing innovative research and healthcare structures together and keeping the translation phase, i.e. the period in which research successes flow into healthcare, as short as possible. Here, for instance, local drop-in centers could be helpful. This year, we will still identify 4 centers for personalized medicine at the university clinics. We have succeeded at, and this fills me with pride, creating a mutual database. Networking works here, even on a voluntary basis. This can possibly serve as a model for other regions. Currently, a debate is on as to whether the concept should be extended to the whole of Germany. We are presently also analyzing the situation in Baden-Württemberg and creating recommendations for action. We also want the therapeutic offer to reach everyone with a medical indication. With all of these, we need to find answers to the question and how to finance all of this in our solidary system. We are talking about therapy costs of up to several 100,000 euros for individual treatment trials. Under the off-label use heading, we also have to take this into account. Also important in this regard is we must ensure that we do not fall behind when compared with international private sector groups. These groups are currently investing huge sums of money which ultimately need to be refinanced. We may not allow our public health systems to become dependent on private monopolists. That is yet another reason why we need to cooperate even more closely in Europe and all over the world. And one last sentence is, we are not really long on start, but now the first, we can say, 65% of the patients, they get help from personal medicine before they had the label no any longer chance for therapy. 65%. You know, it's a new way of life, maybe 1 year more, but 1 year more is 1 year more life quality. 1 minute, sorry. I'm not as fast as spoken naturals. Closing. Within Europe, we have a large number of different health systems, and it is not possible to compare any of them directly to one another. However, we have to learn from one another. We can only solve the significant challenges of global health in cooperation with one another. This does not only apply to infectious diseases, which have never stopped at national borders and demand mutual solutions. Even the major civilization diseases, such as diabetes or cancer, need the joint efforts and the good ideas of all countries to find meaningful and sustainable solutions. Good research and innovation can only be successful together, and these sectors need to intertwine. Today, healthcare is still also an economic issue. We in the United Europe must work on this. Health should not be a question of financial means. Everyone should be able to get the right health care at the right place and at the right time. Here we need joint efforts to give health equality the status it deserves. Because this is where we address the socially relevant questions of social cohesion and solidarity. These are the topics that, in these turbulent times, have become more important than ever. Thank you very much.
So, ladies and gentlemen, I think we still have a few minutes for questions and eventually some answers as well. So my colleague here will be passing a microphone. Who would like to ask a question or make a point here in the second row, in the center?
Thank you. Simon Pickard from Science Business, based here in Brussels. In the last few years, we've been doing work in our network and actually with EPF, with DG Sante and OECD and others on measuring outcomes. Right? This is obviously at the heart of Horizon Europe and the impact of research and innovation investments and instruments. So a lot has been done to try and understand how we can identify and measure outcomes for patients and in the broader context of health systems. But looking into the future, I'm wondering what the priorities are, what additional work needs to be done for us to align the quality of outcomes with the focus of research and innovation around health policy in Europe.
I think that's a really important question, because with the larger investments that one is making, one does want to see outcomes. So being able to track, I think, through the pathways of R&D, first of all, trying to compare the needs and the disease burden versus the investments that are going into it. So if I mentioned that non-communicable diseases, including mental health conditions, are now affecting a large proportion of the population, even in the low and low middle income countries. But the investments in research, in innovation, are not proportionate. So I think one thing is just to look at the balance of whether it's appropriate or not, and then to track through what is happening in terms of investment and what's actually the end product at the end, and what are the timelines taken up for scaling of those innovations to actually have the impacts that you desire that product to have. So I think timeliness, effectiveness, and relevance of the investments and the impact on health. And I think it's the health outcomes that we should really be looking at rather than intermediate outcomes. So again, is the right product being developed for the right problem for the right population? And if the product is being developed, is it actually reaching the people that need it? And what proportion are being left behind?
Thank you very much. We've had a problem ourselves in the health program, the European Union health program, in measuring outcomes, because an individual project, and if you have an individual project, you have 350 projects overall, how do you actually measure the impact of a particular project on a health outcome? This is very difficult because there's so many different inputs into a health outcome. I think what is important is that you have some indicator set or some measuring system to compare yourself with. And, you know, we have the cancer registries. We have our health indicator data. I think it's important to measure progress, not necessarily of a single project, but of a number of projects over a number of years. And in this way, you get some idea of the impact. Okay. Sorry, please.
Sorry, John, I'll just add, Simon, I think it is an important question, and just as a little bit of context, I think from the European Patients Forum and other patients' organisations, we are getting involved more in looking at PROMs and looking at patient-related outcome measures. We're being asked about that, we're being engaged in that. So I think that's showing that the narrative, that the dial is shifting on the narrative. What we've seen less is that patient perspective in terms of being able to see orientation shifts. And I'll give just the one example of where we've worked with patients, and patients have said, well, actually, you know what, we're as concerned about symptoms as we are about cures. And so that is a complete reframing of what you're trying to measure. So I think we're trying to do two things. One is to be able to get more accurate PROMs and to be able to think about them from the outset. But also there's that more fundamental sort of theory of change, being able to say how are we actually going from problem definition to objective setting.
So we have been financing with the OECD a number of projects to try and develop patient-reported outcome indicators in order to have some idea of what the patient's perspective is rather than the people who are doing the project. So that's an important aspect, I think. It's a value added. Are there any other questions from the room? Please raise your hand so I can see you. It doesn't seem to be the case. Any last minute remarks from our panel? Please.
how can patient groups and other advocacy groups in the developed world really help to build the capacity of similar groups in lower income countries? You know, I don't know if you have any ideas, because it's often the case that you don't hear that voice very, very much. And secondly, I would, as you said, everybody is a patient at some time, but if you're well, you don't think about health. How can you get people to start adopting healthier behaviors? It's a question of health literacy, really, and that's, again, something that's needed all over the world. It's not from high-income to low-income countries. So have you thought about health literacy in general and not just about specific diseases?
So, ladies and gentlemen, I'd like to close this session by thanking all our three speakers. We've heard about new treatments, new technologies, new interventions. These all come from dedicated research. And research, of course, doesn't take place in its own environment, but it's part of society. It needs the right partners, the right objectives, the right support. And that's really what today's events here in Brussels are all about, to try and finalize the strategic plan for the first few years of the Horizon Europe programme. I think the indicators we got today and the indications we got today from our three speakers were very helpful. And I noted myself the need to further involve patients in the definition of research objectives and in accompanying projects to ensure a patient perspective from start to finish, but also the underlying importance of having an inequalities agenda for everything in research. Looking as well at the integration of personalized medicine into our health system, new technologies, the workforce shortages that could be a factor there, but also implementing innovation technologies going beyond boundaries between countries and across borders, between professions. You mentioned, Minister, and also being aware that we're facing an artificial intelligence and IT digital revolution, I think you call it. Also boosting our efforts to achieve the Sustainable Development Goals, taking availability into account, taking access perspectives into account, looking as well as at neglected conditions, of course, and looking as well at emerging diseases and having a good gap analysis. So I think we had a good amount of material coming there, but I'd encourage you really to also give your feedback through the public consultation into the strategic plan so we can take as wide a number of points of view into account as we can. So again, thank you very much to our panel. Thank you to you for listening to us, and I hope you enjoy the rest of this seminar. Thank you.